Ma'am, it's trap 9, so with all your due permission, can we begin?
Yes, dear, please.
Thank you, ma'am. Good evening, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, doctor, for today's session. She needs no introduction, but it's my pleasure and honor to introduce such a renowned personality at our platform. She is none other than Dr. Ritu S. Santwani, ma'am. Ma'am is the founder and CEO of 360-Degree Healthcare Studio and Shamwell Women Clinic. She's also an obstetrician and gynecologist, cosmetologist, and infertility specialist. With the help of ma'am, we'll be taking a close look on today's topic, which is low sex drive, decreased libido. Before moving on to today's session, let us have a brief look on what the topic says. Low sex drive or decreased libido refers to a lack of sexual desire or interest in sexual activity. It can affect both men and women and can be caused by a variety of factors, including physical, psychological, and emotional factors. Although low sex drive is a common issue caused by hormonal imbalance, depression, anxiety, etc., it is not necessarily a cause for concern. However, it can cause distress and affect the quality of life. With ma'am and with her wonderful inputs, we'll be knowing more about the topic. So now, without any further delay, we would like to welcome ma'am at our forum and would like to hand over the session to her for her precious talk to begin. Ma'am, over to you.
Yeah. Thank you, Batul. And thank you, IGCP and MedTalks for inviting me here today. So, and warm welcome to all of my dear friends who have joined all across the geography. When today morning I posted the link on my social media, I get lot of queries all across the geography, especially from the Middle East countries. Lot of doctors want to listen about this topic. And also from the Africa, Somalia, a lot of the doctors have put me the query that, madam, we want to know little bit more detail about this topic. So friends, we all know that this kind of patients we are getting every day in our OPD. Especially sometimes, usually the male partner is coming and telling, ma'am, after the delivery, my wife has lost the interest in the sex. Or after she has gone for some job promotion to somewhere place out of the India, now when she is back, she is again having a problem of the decreased libido. So how to treat this? So friends, now I'm going to start sharing my screen. So whatever the question answers, we will discuss post my talk. I much appreciate that if you all of you can appreciate in this interactive discussion. So now, without wasting time, I am sharing my screen. Just a second, I just want to hide this. Yeah. So friends, my all presentations usually starts with Mata Durga Stuti. Ya Devi Sarvabhuteshu Chikitsa Rupen Sansita Namastasyai 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 Namo Namah. So namaste to all of my dear friends who have joined. Friends, before I start the session, I would like to invite all of you for the free one more session, that is the Academic Marathon Session 3, which I'm organizing on the 18th June 2023, in which we have gathered around 12 speakers all across the geography, 9 international speakers and 3 national speakers. That will be a real academic fest. So I would like to invite all of you for this also. So now coming to the topic for today, the decreased libido, the low sexual desire. the most powerful behavior in human, the sex drive is the most important and powerful behavior in mankind. A very famous quote by the Richard Ramirez. So as we all know, regarding the sexual response amongst the male, the desire, erection, penetration, and then orgasm. While in the females, the desire, lubrication, penetration, and then orgasm. So a lot of studies have come in the supporting for this, that how this is a very famous study published in National Library of Medicine, the risk factors which are affecting the decreased libido among the middle-aged to elderly women. So what are these? This study has been recently published in September 2021. So libido, according to this study, this is one more study in June 2022 by Matt Macmillan. The libido loss when men do not want the sex, the desire for sex, your libido tends to lessen with the age in men. In the 2019, they had done the study of more than 12,000 45-year-old men, found that about 1 in 20 reported with a low sexual desire or low libido. But the sex drive varies between the men, so how it is too low? So this study also supports this. A low libido is one of the components of the male sexual dysfunction, which includes the erectile dysfunction, ejaculation disorders, and delayed or inhibit orgasm. Libido, along with the appetite and sleep desire, is an instinct necessary for a person to live and is an essential desire to preserving the species. Therefore, it is one of the important aspects for the quality of the life. So libido varies from person to person and may temporarily decrease due to various mental conditions such as fatigue and anxiety. In general, libido decreases gradually with age. Indeed, the decreased libido is well-known symptom of late onset hypogonadism syndrome, which is a cluster of various clinical conditions caused by testosterone decline with age. So friends, this is a very important syndrome, the late onset hypogonadism syndrome. So indeed, the aging male symptoms, AMS scale is used worldwide for the screening of LOH syndrome, includes a questionnaire about the decreased libido. So those who want to go for this scaling, you can put on the Google the aging male symptoms scale. You will get all these details, and for the LOH syndrome also. So libido was assessed based on the AMS scale, decrease in sexual desire and libido, lacking pleasure in sex, lacking desire for sexual intercourse. It has been scored from 1 to 5, indicating none to extreme. A score of 4 or higher on AMS was defined as severely decreased libido, severe group, whereas 3 or less of AMS was considered as none to moderately decreased libido, non-severe group. So decreased libido involves reduced frequency of sexual thoughts and fantasies, interest in sexual intercourse, frequency of sexual activity, sexual stimulation by sight, words, or touch. Persistent decreased libido can bother couples. In today's aging society, the decreased libido can be one of the important problems among the elderly men that impair a couple's quality of life. In addition, a recent study demonstrated a close relationship between the libido and cardiovascular diseases, concluding that maintaining the libido could have a beneficial effects on cardiovascular and overall health among the men. So known causes of decreased libido in men include the psychosomatic stress, cranial nerve diseases, endocrine diseases, drugs, old age, and the testosterone decline. In the younger men, the most common cause of decreased libido is psychosomatic stress. Psychological factors such as depression and anxiety can also inhibit the sexual desire, and low sexual desire can have an adverse effect on many psychological and social aspects. On the other hand, the middle-aged and elderly men often may have many comorbidities such as testosterone decline, lifestyle-related diseases, urinary disorders, and depression. These comorbidities and some lifestyle habits can be directly and indirectly associated with decreased libido. So here, friends, we can see with this obesity, the low testosterone level. So what are the risks that are associated with that? The chances of the stroke are high, heart disease are high, increased fat tissue, increasing the risk of the erectile dysfunction, loss of muscle tone, enlarged prostate and prostate cancer, and constant fatigue. So a lot of these are reported with the obese. So now what are the causes which can cause the low libido? So we will take one by one. So friends, here we can see, yes, the smoking, some relationship issues, psychological, depression, chronic health conditions, then coming to certain medications, fatigue, being overweight, and the stress. These are the some things which has been reported for this. So the potential causes of the low libido has been mentioned: the hormonal changes, high BP, drug abuse, sometimes the body image problems, low self-esteem, fatigue, antidepressants, and the pregnancy among the females. So this hypoactive sexual disorder is the deficiency or absence of sexual fantasy or desire for sexual activity. Females are more affected 40% than males. Usually what we think that only the males are coming with it, but usually this female sexual dysfunction is actually it's reported to be more around 10% more compared to the males. So effects of this HSD, the chronic stress, anxiety, depression, lack of concentration, insomnia, irritability, relationship conflict, and the social withdrawal has been reported. So here we can see, so where your mind does not know, eyes cannot see. So friends, we can go one by one on the causes. Among the physiological, yes, in the pregnancy, menstruation, menopause, lactation. Amongst the systemic diseases, the diabetes, thyroid disorders, hyperprolactinemia, hypopituitarism, gonadal failure, hypertension, fatigue, depression, renal and liver disease, infertility has been reported. Amongst the drugs, the antihypertensives, the beta blockers, patient is on anti-androgens, anti-epileptics, antidepressants, previous bad experience, if she is having a painful sex, or the erectile or ejaculatory disorder, sexual assault, and the fear. Fear is also, so many patients are coming for that. Guilty feeling, fear of STI or pregnancy, relationship problems, interpersonal conflict, monotony, and sexual orientation has been reported. So we will go through with some cases one by one. So friends, I tried to make the presentation based on the practical aspects of what I am getting the patients in my OPD. So a 52-year-old lady underwent menopause 3 years ago and is no longer interested in sex. No issues with the lubrication or pain, but she is feeling difficulty due to obesity. Low libido after menopause is actually a misconception. Obesity, the mechanical difficulty in certain sexual positions. Yes, we advise for the Kegel exercise. And in some patients, yes, if the vaginal dryness is an issue, we give some estrogen supplements or the non-hormonal supplements, the soya supplements or the glycerol, and so many other things are available these days. So hormone therapy for postmenopausal low libido, the HRT may improve the general well-being and libido. Vaginal estrogen and systemic HRT can be considered when systemic HRT is contraindicated. Tibolone androgenic and it does not stimulate the breast and endometrium. So the most preponderant female sex hormone. So amongst the testosterone preparations, the oral The methyl testosterone, micronized testosterone, and DHEA has been reported. Among the transdermal testosterone patches and gel, testosterone ointment or cream, 1 to 2% has been reported. Injectable and implants, intramuscular testosterone injections and implants has also been reported in the literature. But the side effects of what has been reported with this amongst the cosmetic, hirsutism and acne, irreversible virilizing changes, voice deepening, clitoromegaly. Most of the androgens are aromatized to estrogens, thus risk of the estrogen therapy also possible with the androgen treatment. So now the question comes, can we use this testosterone? A transdermal testosterone patch is licensed for the treatment of this HSD in the surgically menopausal women on concomitant HRT. No pharmacologic therapy is currently approved for the treatment of HSD in the premenopausal or naturally postmenopausal women, and further research is urgently needed in these populations, because India being a tropical country, giving this patches is little difficult. So still a lot of work is going on, yes, but we are giving in some patients the local estrogen, and local gels are also available these days, which are having the some soya isoflavones and glycerin composition. Now coming to the case 2, the couple is happily married for 5 years, having a baby girl. Men said that she is not interested in sex for the last 1 year. She said that she is having enough desire and lubrication, but soon after the penetration, she lost the further interest. This is a one GIF I found, so I thought I must insert this in the presentation. So like these, lot of patients are coming in our OPD, and these questionnaire is based on what I'm seeing in my OPD. So early orgasmic response, equivalent to premature ejaculation in men, orgasm to ejaculation, orgasm to vaginal contraction after play is also important. So SSRI paroxetine 20 mg 2 to 4 hours before the sex will be useful in these patients. Coming to case 3, a 32-year-old woman presented with low libido after cesarean section, done 6 months ago. Previous sex life was normal, adequate lubrication, penetration and orgasm has been reported. So, so what are the causes for this, and causes and treatment for this postpartum low libido? So the change in the position, cross leg, Kegels exercise, lubrication, episiotomy stitch, reconstructive surgery, rejuvenate the romance, ambience, bath, together removal from the boredom of the bedroom. So these are the some changes what we suggest to the patients if the lubrications are on lubrication. Yes, once the episiotomy stitches will heal, there will be no problem. And changing in the position and change in the place also will sometimes solve the problem. So while in some patients it has been reported the idiopathic low libido, yes, then in that cases the lifestyle changes, improving the body image, sex therapy, psychotherapy and pharmacotherapy has been reported. So, so this is the very common question, that how to get her sex drive back. So lifestyle changes, the reducing stress, exercise, yoga or some relaxation techniques. And we always advise the patient that regular date night to spend 1 or 2 nights away from the other family responsibilities. See, basically we have to do the very good counseling and we have to listen whatever the problems patient is saying. Improving of the body image is also a very important factor. So the weight reduction, bariatric surgery, and treating the pelvic floor dysfunction. The sex therapy in this, the educating women and men, addressing the cultural or religious concerns, assigning the specific exercises, direct patients to a wide range of helpful resources, including the book lists, visual aids, and devices has been reported. Sensory focusing, this is also very important. Heightening of the sensory awareness, in which the 4 stages has been reported. Stage 1, when the partners touch each other. Then the stage 2, the partners touch each other's genitalia. Third, the mutual touching. Then fourth, the woman on top. Amongst this pharmacotherapy, yes, we will take one by one. Yeah, fibrosine, recently centrally acting serotonin receptor agonist, and that results in the transient decrease in the serotonin, increase in the dopamine and norepinephrine in certain regions of the brain. This is the only drug approved by FDA for female sexual dysfunction, while the side effects has been reported like somnolence and dizziness. While the another is the bupropion, a centrally acting agent. The mechanism of action is also similar. This is again the off-label use. Then the buspirone can be helpful, particularly in SSRI-induced low libido, PDE5 inhibitors. So some studies have shown that the positive effects has been demonstrated in premenopausal women with SSRI associated with sexual dysfunction. Ginseng, yes, lot of studies have come, but some side effect like intermittent postmenopausal bleeding is reported in some patients. Then yohimbine improves the genital blood flow. Then amyl nitrate, headache and palpitation, the side effects has been reported. So a lot of studies have been supported by the Cochrane also. The DHEA might slightly improve the sexual function. No evidence that DHEA improves sexual functions more than HRT. So amongst this placebo therapy, yes, most of the time we have to counsel the patient properly and listen to them, and sometimes their vitamin tablets also can work. Then what is the best aphrodisiac for these patients? So we can see the interesting and interested partner. This is a very famous quote by Master and Johnson, that the best aphrodisiac is in interesting and interested partner. So relationship with the new partner, research on the sexual function constantly demonstrates the increased libido, pleasure in new relationships. Then where there is a marriage without love, there will be love without marriage, a famous quote by the Benjamin Franklin. Then coming to the case 4, friends, as I have a time of only half an hour, already 20 minutes are passed, so I will take this quickly, the cases. So the young couple had very happy sex life, consulted doctor for infertility of 1 year duration. Then he usually advised the patient that timed intercourse. So husband suffers from the lack of interest and described the sex as a mechanical entity. So they say that now till as soon as madam you advise to have a relationship on these dates, I am not able to perform. So husband usually suffers from lack of interest and described as a mechanical entity. So studies has been supported by the British Journal, the sexual dysfunctions induced by stress of timed intercourse and medical treatment. So there are a lot of studies has been presented related to this female sexual dysfunction. So the people, again, this is one study has come with a fertility problem, that people who are concerned about their fertility should be informed that vaginal sexual intercourse every 2 to 3 days optimizes the chances of pregnancy. So this has been reported lines. So infertile couples with low libido, the testosterone in men and the lubricant in female has been reported. So best lubricant is the adequate foreplay, and then the vaginal fluid comes. So amongst this case 5, the young couple presented 6 months after the marriage. Women are not interested in sex after first few episodes. Then on examination, the hollow pouch is seen near the urethra. So in these cases means the intercourse is happening near the urethra, and the female lack of anatomical knowledge. In these cases, the female can guide the male. In the dark, it is easier to put the food in your own mouth rather than trying to feed someone. Among this case 6, the young woman presented soon after the marriage with loss of libido after first night. Enough lubrication, penetration, no pain, but she is fantasized about the men with the large penis. This is a very common problem. I am seeing a lot of patients of this kind. So they see the porn, they see some movies in the YouTube, and they think that why the penis is not as large as shown in the movie or the pics. So, yeah. Some back noise is coming, Batul. So, yeah. History taking in low libido is important. So, the misconceptions, unrealistic expectations, disturb interpersonal relationship, details of sequences, desire, erection, lubrication, penetration, and orgasm during masturbation and orgasm with other partners has been a very important question. So whether this is with the wife or with the other partner also. So seeing together is very important in this case, as the male and female thinking process are little different. Females usually need for the commitment, while the male needs for the sex only. So differences in the sexuality, about 1/4 of the female think about the sex daily, while the majority of the adult men will think about the sex at least once a day. Female wants commitment throughout the relationship, while the males want the sex at the start in the relationship, in the middle, and after many years. So on the lighter vein, I'm putting this slide. So lots of emotion to sexual encounter, while in the males little emotion, and the females wants lot of sex with the partner they love in a suitable ambience, while with the males wants of lots of sex only. So these are the some differences which has been reported. So the approach should be non-judgmental, no assumption, acknowledge difficulty in conversation, and we have to let the couple speak. So a lot of studies has come again in the favor of this. So what are the treatments available for this low female libido? Lifestyle changes, the natural supplements, the medications, among these foods which will increase this foods which will help to boost the libido during menopause, the green oats, oysters, strawberries, pomegranate, figs, red chili, maca, and honey has been reported. So what is the best supplement to boost the libido is the DHEA, fenugreek, ginseng, L-citrulline, maca, yohimbine, and vitamin E has been reported. So is the vitamin B6 is good for libido? Yes, the studies have come. The B6 regulates the sex hormone and it ups the libido by controlling the raising of prolactin levels and regulating the production of the estrogen, testosterone. While with B12 increased libido, yes, the lots of studies have come. The regular dose of B12 desire for the sex will also have increased. Yes, again, the other important one is the zinc. We all have eaten a lot of zinc daily at the time of the corona period. So zinc has a positive effect on the arousal and maintaining an erection. So a lot of studies have come in the support of this also. So the medications what are available for increasing this is flibanserin, AD, a pill once a day at the bedtime. The side effects are low BP, dizziness, nausea, and fatigue. Then the bremelanotide injection to be taken by herself under the skin in the belly or thigh, anticipated before anticipated sexual activity. So, but unfortunately, these two are not available in India. Yes, Eddie, you can search in Amazon. Sometimes the patients are getting from there. Yeah. So the take-home messages are the low libido is underreported, under-evaluated, and under-treated. Then proper history taking will disclose the diagnosis in most cases. Problem lies in between the two legs, and the problems not lies between the two legs and the problems in between the 2 years. So both the partners should be seen together. Non-pharmacological interventions often works well. So thank you, dear friends, for your interest and your time. I know this is the time once we finish our OPD, or some of us are still in the OPD. And so thank you once again, and thank you. Again, I would like to invite you, all of you, for the 18th June academic year. So I had done earlier also 3 academic marathons. This is a season 3, which all were appreciated very well by the doctors across the geography. So I would like to invite you all for this academic marathon, where there is a collection of the national and international stalwarts, the stalwarts all across the geography, from the Cario, from the Middle East countries, from the Bangladesh, from the Pakistan, from the Nordica, from the US, from the Philippines, will be in this program and speaking on one of the interesting sessions. So thank you once again, friends, for your interest and for your time. So I will stop sharing. Yeah.
Thank you so much, ma'am, for such wonderful inputs upon the topic that you have shared. We hope that all the viewers who have engaged today must have gained the knowledge that they were here for. So thank you so much for that. We have received few questions, ma'am, so I would like to put it across to you.
Yes, sure. Thank you.
Yeah, the first question is, how do we know if one's libido is low?
So I have just shown the slides. May I know the doctor's name? Who is
Dr. Rita. Dr. Rita.
Okay. So Dr. Rita, I think you have joined the presentation late. See the recordings. I had already explained in the first few slides. Yeah. And for the males, you can go for this age AMS scaling that you can get very easily in the Google. Yeah.
Thank you so much, ma'am. We'll move to the next question, which has been asked by Dr. Sangeeta. Dr. Sangeeta wants to know what medications are available to treat HSDD.
So for that, I already showed you. This is the last 2 slides. See, these 2 medications are only which has been approved by the FDA. So, but none of these are available in India. Sometimes, yes, you get this lebenserine in Amazon, but usually we give some other supplements to the patients, mostly the dietary changes, reducing the stress, and proper counseling. These only I am giving these, and these are doing the miracles in the patients. Yes, the proper counseling is must. Yes, but anyhow, if your patient can buy these 2, either this bromolanotide injection or this ADI, so that will having a miraculous results. If the patient can get somewhere or someone is outside, so these 2 drugs are only FDA approved. Yeah.
Thank you so much, ma'am, for answering this question. With this question, we are also receiving a question from Dr. Ria. Dr. Ria wants to know what are the potential side effects of taking this medication?
Okay. I already shown dear. See, with this flavis, some patients are getting the more nauseating sensation, and some patients are getting a little bit of the itching on the body. This has also been reported, but in very few patients. Still the studies are going on. Still the drug is not available in India. Only few studies are available. Once you Google, the very few studies are available. That it is reported only in 1 or 2 patients the itching is reported. Mostly the patients has reported this nauseating feeling and the gaseous distension.
Thank you so much, ma'am, for answering it. We'll move to the next question, which has been asked by Dr. Nirja. Dr. Nirja wants to know, are there any at-home treatments available for HSDD?
I already shown what are the dietary advices what we provide. I already shown. So Dr. Nirja, please go through the presentation once. You will get your answer. Yeah.
Thank you so much, ma'am. As of now, we are not having any questions on our screen. So with this, we would like to conclude the session here for today. And I would like to thank all the viewers. And at the outset, I would like to thank you, ma'am, for taking out your valuable time and for keeping up with such an enlightenment presentation with all your wonderful inputs about the topic, ma'am. Thank you so much for that.
Okay, dear. Thank you, Batul, and thank you, IJCP. With this, we will conclude.